Active patients under care. I think it is the most relevant, not talked about statistic there is. I know that we talk about things like numbers of new patients, number of adjustments per week, collections, PVA, all these different stats in chiropractic. But I think this one statistic is the most congruent. It's how many individual lives are you affecting? You know, you could see 300 a week, but you could have 100 people all coming 3 times a week. So now you're seeing 300 a week. Or you could see 300 people once a week. I think if every single doctor I've ever dealt with, mentored, trained beside, or learned from, I think we'd all agree that we'd rather see 300 people once a week than 100 people 3 times a week. And the reason is simple. It's the same volume, but it's impacting a larger proportion of people. And active patients under care, in my office, I do it this way. Anybody who has been in for an adjustment sometime in the last month. Now, I know that the majority of people are coming in once a week or once every 2 weeks, but you're still going to get the odd person that maybe they're away on vacation or whatever. But I would consider if somebody's been into my office in the last month, then they're actively under my care. If they haven't been in 6 months, that's not actively under care. That's, a patient that's, it's going to be reactivating, I guess, but it's not active patients under care. And this statistic, it is one of the most humbling statistics. So what you do is you use your software to see what are the number of patients that have been in the last year, or in the last month, sorry. You may want to just do active patients for a certain time range, and then if you go to the last page, it'll tell you how many files there are, whatever it is. For ours right now, it's 1,460, because I just checked it this morning. So 1,460 is the number of active people under care. Sure doesn't sound like much, does it? It's sad, really. But it is the most humbling statistic. When I first started keeping this statistic, I was already seeing 800 visits a week at that point, but I had less than 500 people under active care. That meant that I was in a massive growth phase. I had a pile of people coming in multiple times per week, but I really wasn't helping as many people as I wanted to. My goal now is to adjust people as few times as possible to keep them clear of subluxation. So my goal is to get better at adjusting them. My care plans have less adjustments in them now than they did 10 years ago because I'm getting better at clearing them out. And so, rather than the old care plans, which used to have 80 to 100 adjustments, I'm somewhere between 40 and 60. Now, I don't want you to sit there and go, holy crap, I'm adjusting too little, or holy crap, I'm adjusting too much. Forget it. This is not a comparison. Don't worry about it. I don't tell you those numbers so that you have something to shoot for. I tell you because my mindset is if I can get them clear with less adjustments, then in the same amount of time, I can help more people. So that's my goal. Adjust more efficiently, adjust faster, and adjust more people. My goal when I first started mentoring, I was at around 1,100, was to get up to 1,200 that year, and then get up to 1,300. And now we're over 1,400 active people under care, and I love it. But think about how small that number is compared to the large number. It's crazy. Look up your active patients under care. Use it as a statistic. I think it's a great way to measure whether or not you're getting close to what your ultimate mission is, which I know is to help as many people as you can with the best type of care that you can. Have an awesome week.